The next morning, they headed out bright and early from their hotel in Taipei to travel about 3 hours south to Chiayi City for interviews with Dr. Lo and his brother David. They were honored to have Dr. Tony Jimenez visit the clinic and even had a scrolling banner in both Chinese and English welcoming him to the clinic. What a kind gesture.
Well, Dr. Lo, thank you so much for having us here in your office today.
Yes.
We really appreciate your hospitality. You have been amazing. Just so those of you that are watching know, our trip to Taiwan really would not have been possible and would not have been fruitful at all without Dr. Lo. He connected us with almost everyone that we've interviewed here. Was at a conference that he threw yesterday. So we're very grateful for you, because without you, we would not have had all these interviews in Taiwan. So thank you.
My pleasure.
When did you begin to become interested in natural medicine, integrative type medicine, specifically as it relates to treating cancer?
Oh, okay. Because I'm the traditional Western medical doctor. Several years ago, I got a cancer. At that time, I received the standard therapy, including surgical removed tumor, then received chemotherapy. After chemotherapy once, then I give up because it's very terrible.
What type of cancer were you diagnosed with,
Oh,
and when?
I have many kinds of cancer, including urogenital, liver, and or lung. Many organs.
You had several types of cancer.
Yes.
Okay.
Yes.
When? What was the year?
When? About 6 or 7 years ago, I find many chronic illness, chronic disease like hypertension, diabetes mellitus, or chronic kidney disease. It might be cured without medication if we had adequate detoxification. That changed my concept, because from my medical training, after I graduated from medical school, the medical observation tell us chronic illness should be used medication long term to control, not cure. I find one truth: anti-cancer is the way, the method of anti-cancer is the same of anti-aging, the same principle. I use this principle to treat cancer patients and chronic disease, and I have found some amazing results. Amazing.
You're the second doctor in Taiwan that has said anti-cancer and anti-aging are almost the same.
Yeah, the same principle.
Dr. Inta Lo just reiterated what Dr. Magic Kuo told us earlier about the link between anti-cancer and anti-aging. Dr. Lo also mentioned that adequate detox is the key to curing chronic disease.
What herbs do you use to detoxify your cancer patients?
Oh, I can see ABC, A, Androgeal campylorata, B, bamboo charcoal pellet, C, cordycepin. I can show you the product.
I would love to see it.
First, Androgeal campylorata. Androgeal campylorata. The second effective ingredient is cordycepin. The cordycepin is from mainland China. The mainland China, we call it 冬虫夏草. Androgeal campylorata is belong to yang. Cordycepin belong to yin. Our technology is we can use the yang component and the yin component put together. As I know, in the world, only we have the special technology. We have patent. This product, we have the evidence based. If the product used, then will keep our immune system balanced. So anyone can use this product.
So the combination of Antrodio campylorata with cordyceps acts as an immune balancing supplement, in Dr. Lo's words, balancing yin and yang. But that's not all. Antrodia contains triterpenoids, beta-glucans, and SOD, superoxide dismutase, all of which have been shown in numerous studies to exhibit anti-cancer effects. Cordyceps mushrooms contain cordycepin, which has been shown to be anti-cancer and anti-metastatic and to help prevent and reverse bladder, colon, lung, cervical, breast, oral cancer, and leukemia. Dr. Lowe then shared with me what was likely the most unique supplement I saw on the entire Asian trip.
This capsule, not medicine, is made from the bamboo grows in my native place, Jiayi Mountain, near Ali Mountain. No pollution. We have checked. Okay, we use the technique from Japan, nanometer technology, and 磨粉很细的粉，磨粉。
Grinded as
Oh.
a powder.
Grinded is a very small powder. Yeah. One capsule has 830 particles here. One particle, when this pellet into our stomach, they don't release. Into our intestine, they don't release. But when it enter our colon, the environment of colon, the pH value of our colon environment is 7.3 also. Then it will release instantaneously to 27,000 particles. And it can be long-term use because it is safe, not medicine, but it is effective.
Okay, so that's
Okay.
just ground bamboo.
Yeah,
what it
yeah,
is?
yeah.
Ground bamboo from the
bamboo,
mountains here.
From the Chiayi, yeah.
Okay.
Near Ali Mountain. Next time when you visit,
Yeah.
I will take you to see
Fascinating.
the bamboo.
Okay, great.
Okay, okay.
That's great stuff. I want a bottle of that before I go.
Ty actually did get a bottle of bamboo charcoal pellets right here from Dr. Lowe before he left the office. You may have heard about using activated charcoal to detox, but did you know that bamboo is actually better than activated charcoal for detox? It's 40% more absorbent than cotton and very porous. But using bamboo to detox is not the only unique aspect of Dr. Lowe's protocol. He is also able to diagnose genetic weakness via a process called iridology. Let's go back to Ty's interview with Dr. Lowe as he shares more about this fascinating topic.
Iridology is, it can show the genetic defect, genetic weakness from our iris. And about sclerology can tell us where is the toxin from and his effect. And he can tell, the sclerology can tell us whether our detoxification successful or not.
I asked Dr. Lowe about how he is able to so accurately measure energy in his patients, and he described a machine called Metatron.
Metatron
Okay.
was made in Russia about 10 years ago.
Okay.
I'm the first doctor in Taiwan use the machine. I go to Russia and bring back to Taiwan. And now the machine has obtained the TFDA approval. I use the machine to know about the energy inside. For example, TCA, traditional Chinese medicine, they will 把脉, palpate your pulse. Then they will know weak or strong, right? But only just TCM doctor know, patient don't know. But the advantage of the Metatron machine, it can show us how is the energy inside, from color, from line, curve line, from number, and from medical term, it can clearly tell us. It's more advanced than median machine, median, 经络仪, median machine,
Meridian.
Meridian
Okay.
machine, and more advanced than quantum machine.
So
Quantum,
this is a machine
Yes.
that measures your energy through the meridians. Through your
better than
meridians.
meridian, yeah.
Okay. So even better than that.
Better and more convenient,
Okay.
more accurate, and have evidence-based data, very objective data, not subjective.
Metatron can detect and match the frequency of any human body part, organ, tissue, cell, DNA, or chemical. It's an excellent device to help measure the etiology or the cause of the cancer. Here's Dr. Lowe talking about a patient of his that had breast cancer, which was caused by parasites and also emotional imbalance.
Like my patient, breast cancer, do you remember? breast cancer I see there are some parasite. Parasite is she have many causes to get the breast cancer.
Yeah.
One is parasite, another is emotion. Emotion, very stress, bad mood, and easily angry to others, and even her marriage is not smooth.
Okay, so Dr. Lowe just mentioned one of his patients that got breast cancer, and he was able to see that it was because of parasites and so forth. So we're going to go to that right now, and you're going to see a little bit about that interview.
Before we go to the interview, let's set the stage. Chen Yang was diagnosed with breast cancer in 2014 and had a double mastectomy. She then decided to forego chemotherapy and become a patient of Dr. Lowe's. Two of her primary focuses of her treatment were emotional and also detox, specifically from parasites.
像我治疗的那个部分哈，如果你们觉得不需要再剪掉哈，我有花精疗法。花精它是针对我的情绪，好，因为我那时候当校长，我的压力非常的大，好，然后我曾经罹患过忧郁症，所以我的情绪呢起伏很大。那但是花精它是透明的哈，然后让我滴在水里，我这样每天喝，那所以它可以让我的情绪维持比较平衡，那我的身体的能量会比较 OK。好，然后另外就是一个叫做天然的抗生素，好，它是可以让我的那个寄生虫，好，就是消灭我的寄生虫，它是天然的，好，也是用滴到水里面喝。然后另外就是有那时候有给我喝那个牛樟汁跟水果的酵素，好，一天喝1罐这样。还有另外就是改善我的肠胃的，好，给我益生菌，好，那我就是整体的。好，除了打点滴之外，还有皮下注射的减敏，好，还有吃这些可以提升我的免疫力跟让我的身体的那个好的环境哈，制造好的环境，还有有一种塞剂，好，就是晚上睡觉的时候塞在肛门哈，它是排重金属的，所以每一样东西呢，这个罗医师都跟我解释的非常的清楚，好，然后我也非常的接受，好，因为我觉得说用这样的方式治疗才能够让我的身体好从不好变成好，好，那我就接受了这套疗法结束之后呢，我做了好像3个循环吧，12周，12周，一周4个礼拜，对，12周，好，做了12周，好，然后我跟罗医师讲说，我整个结束之后，我要再做一次的4D 的那个检查。好，那在前面的检查我漏掉一样，还有个虹膜。好，虹膜就是眼睛的这个部分的。好，那我整个治疗结束之后，好，这个罗医师就帮我再做了一次4D 的影像的这个检查。然后我一看到那个所有的那个影像里面呈现的那个黄色的，就变得整个都是黄色。很多黄色，然后偶尔有一些是那个红色，好，但是已经没有黑色跟咖啡色，所以我就知道说我的身体已经变好了，好，然后罗医师就跟我讲说我已经改善了95%，所以我检查报告的那个书面的资料就本来很厚的一本，变成很薄的一本，然后我就非常的高兴哈，就是我的身体的这个部分就得到很好的一个医治。对，那我就持续有做减敏，然后到最近我就有比较没有那么常过来，因为我的身体状况就维持得很好。对，然后也推荐很多人，嘿，有很多的好朋友，我觉得不一定要得癌症才来接受治疗。
Yeah, I'm really happy, and I'm a Christian, so I really thank God to allow me to know this.
Sorry, 花精疗法。
上帝祝福大家。
Wow, so she's a principal at the school, and I think your father-in-law was there, right? He referred her to you.
They have a circle. The principal, they have a meeting, and like a club, so they can communicate.
Okay, very good.
Okay, yeah.
Great. So that's a great testimonial.
Let's listen to a little bit of the story from Dr. Lowe's father-in-law, who was actually the principal at the same school where Chen Yang worked. He was diagnosed with liver cancer in 2013.
就是来做血液，那个什么血液透视还是什么样哈，就把血液抽出来，再进能量，去经过处理以后再进来的， 就好像我觉得那个血液透视我方法，我觉得好像很特殊的做法，有帮助，细胞免疫疗法，这细胞免疫疗法，就把血抽出来整理以后，就那个又注射回来，很有效。几个朋友他有的比我慢发现癌症，都比我早。我现在都好像没有生病的人，但是有一个感觉，跟我同年龄的，好像都回去很多同学，结果呢，我还是留下来的几个之一。我的同学当中，现在已经81岁了，去的人很多，留下来的不多，我还是留下来的一个，这是靠这家医院的功劳。
What a great story from Dr. Lowe's father-in-law named Mr. Lin. I asked Dr. Lowe to list some of his most effective treatments for cancer.
For example, ozone therapy. For example, light therapy. Different light wave.
Light therapy.
Light therapy, yeah. Different light have different wave and have different energy. Yeah.
Okay. Have you used intravenous vitamin C? Do you use that protocol?
Yes. Standard treatment.
Okay.
And I add energy to vitamin C. For IV, I add energy like flower essence.
Floral essence.
Yeah. We use water. We add the energy of flower into the water, so patient can drink the water to treat with the flower essence. The similar way, we use the nutrition IV form. Then I add energy to vitamin C, and it will have more effective.
Wow. What kind of flowers do you use for the flower essence?
Many kinds. We will search the proper frequency of flower to treat patient.
Wow, that is so fascinating. Dr. Lowe is using so many different treatments: medicinal mushrooms, bamboo, high-tech machines from Russia, ozone and light therapies, intravenous vitamin C, and even fluorescence. And the two patients, Chen Yang and Mr. Lin, were inspiring, weren't they? After finishing the interviews at Dr. Lowe's office, our team had a tour of Chiayi City and learned a lot about its unique history and got a chance to see some amazing sights. Then they proceeded to the office of Dr. Lowe's brother, David, where they learned some vital information about the oral link to cancer.
See that picture over there? This is oral cancer, the patient. The soft tissue has necrosis. We still can find these pathogens in the wound soft tissue. Yeah. So any infection patient, she has a lot of combined microbiota. In the gum, we name periodontal disease. In the pulp, we name periapical periodontitis or periapical cyst. In the necrotic tissue, maybe become oral cancer. If I use the correct medicine and I use the, we name APDT, antimicrobial dental dynamic photodynamic therapy, or I use the oxygen plus ozone therapy, and I use the amino acid particle to impact the infected area. This method will kill the microbiota, and the wound will heal very rapidly.
What would the wound be created from?
The origin may be from surgery, or maybe from trauma, or maybe from cancer therapy, or maybe from periodontal infection, endodontic infection, or dry socket after oral surgery extraction.
So yeah, I know that dry socket can be a big problem after oral surgery, and they can cause a lot of pathogenesis in the mouth, can cause a lot of microorganisms. You were showing me unique perspective that you have on that, to heal the wound and to regrow the bone. Could you explain that?
First, we need to face the infected material, infected tissue. So we need to find what is the pathogen infect this area. After I know the pathogenic origin, and I can find the good medicine for the patient. Everyone is different. And then at the same time, I use the laser. The cell wall of the bacteria will dissolve. The bacteria will
So you use
killed.
laser to disinfect the wound.
Yes.
Okay.
This is the second pathway. The third pathway, I use the ozone to treat the infected area. And we can find the tissue will disappear. The necrotic tissue will disappear day by day, days by days. And the new tissue will grow day by day.
Okay.
So they can be cured.
Now, dry socket develops when the blood clot at the site of surgery disintegrates or is dislodged. This condition can cause severe pain, and if it doesn't heal properly, can cause chronic inflammation, and chronic inflammation has been linked to cancer. Something else that has been linked to cancer is mercury, which is the composition of those silver amalgam fillings that dentists like to use. Now, approximately 50% of dental amalgam is actually mercury. Interestingly, thimerosal, which is used in vaccines as a preservative, is also 50% mercury. Here's the MSDS for thimerosal. That's the Material Safety Data Sheet. As you can see, it says that it may cause cancer based upon animal data, no human data found. In a global quest, Dr. Thomas Lokensgaard had some great input about amalgam fillings.
The silver fillings, you're right, they're about 40% silver. The rest is copper, tin, and mercury. 43 to 55% is the mercury in a silver filling. So it's a huge problem. And the question is, do they outgas? The ADA's position, the American Dental Association's position, is that they do not outgas, is that they are inert. Well, I have news for the ADA. This is not true. They do outgas, and they outgas from the time they're put in to the time they're taken out. When they outgas, what happens? Mercury is a known toxin, not a dental toxin. It's just a known toxin. It's very toxic to the neurological system. Mm-hmm. It's very toxic to the gastrointestinal system. It ties up candida, some people will call it. And so if you have a candidiasis or candida infection, or you have gut dysfunction, it's going to mess with that. It's going to be very difficult to fix your gut. It also it has an affinity for fat tissue, and since we're all fatheads, it goes to your brain. Okay, so it has a great affinity to cross the blood-brain barrier, to cross the placental barrier. That's really bad news, because that's supposed to be a sterile environment, and it causes memory loss, it causes fatigue, it causes brain fog. I can tell you story after story after story of patients that have had their mercury fills removed the proper way. Mm-hmm. We put all the garb on them. We make sure that there's no vapor escaping into crossing the blood-brain barrier, the placental barrier, and they come back months later and we say, "How are you feeling?" They go, "I feel a whole lot better."
As a dentist, do you find that it's important if let's say you have a patient that has cancer, is it important to you to remove the mercury fillings from their mouth? Do you remove mercury fillings?
Yeah. Frequently, I remove the mercury material because it is a toxin for everyone and for the environment. Yeah. So I have this vacuum to aspirate the vapors of mercury.
Okay. I know that's important. That there are some dentists that say they will remove the mercury, but if they don't have the proper equipment, it could be much more dangerous for the patient. You've got that equipment here. Somebody that's watching this documentary, can you connect the dots, or at least try to correlate how important it is what you do in preventing and even treating cancer? How are they connected, in case somebody isn't understanding how this is connected to cancer?
Basically, if the patient is a cancer patient, he needs to accept the chemotherapy or radiation therapy. Their immune system will be destroyed. So if the problem of of the mouth do nothing before the treatment, they will happen severe clinical outcome when they treat the cancer.
That's very interesting. Dr. Lo Taweo is saying that if you are going to undergo chemo and or radiation, it's vitally important to clean up your mouth before, otherwise your outcome won't be as good.
I've interviewed several dentists that believe that you can't safely perform a root canal and disinfect the tooth. They believe that if you root canal a tooth, that you're going to seal in some of the microorganisms and it will cause problems down the road. Do you believe that you can safely do a root canal, or do you recommend that you just pull the tooth?
If the root canal system may not check the microorganism, or we don't use APDT or ozone in the pulp system, even we finish the root canal feeding, the disease will recur. We need to look at the intrapulp structure, and we need to face the infection situation. If the 2 points we can achieve, the root canal therapy will be successful.
Dr. Lo Taweo is the only dentist I've ever interviewed that has discovered a method to successfully perform a root canal using ozone and ADPT therapy.